Pemetrexed is a medication used to treat specific types of cancer, such as lung cancer and mesothelioma. It is a chemotherapy drug that helps to slow down or stop the growth of cancer cells in the body. This medication is usually given as an intravenous injection, and the dosage and timing of the treatment will be determined by your healthcare provider based on your individual condition. It is important to follow the dosage instructions carefully and to receive the treatment at the optimal timing recommended by your doctor. Before you start receiving Pemetrexed, make sure to read the patient information leaflet from your pharmacist. This medication is administered by a healthcare professional through an injection into a vein, usually once every 3 weeks. The dosage is determined by your medical condition, body size, and response to treatment. To reduce the risk of skin reactions, your doctor may prescribe a corticosteroid medicine to take around the time of each treatment. It's important to consult your doctor or pharmacist for more details on this. In order to lower the chance of side effects, it is crucial to take folic acid vitamins and receive vitamin B12 shots before and during treatment with Pemetrexed. Folic acid vitamins can be found over the counter and in many multivitamin products. Your doctor will give you a vitamin B12 shot into the muscle, usually 1 week before your first dose of Pemetrexed and then once every 9 weeks during your treatment. Make sure to consult your doctor or pharmacist for more details on this. Some common side effects of Pemetrexed Disodium 500 mg intravenous powder for solution folate antagonists may include nausea, vomiting, loss of appetite, diarrhea, stomach upset, changes in taste, constipation, mouth sores, and tiredness. Your doctor may prescribe medication to help manage these side effects, and you can also try eating small meals and avoiding eating before treatment to help lessen nausea and vomiting. Temporary hair loss may occur while using this medication, but normal hair growth should return after treatment has ended. It's important to be aware of potential serious side effects, such as numbness or tingling skin, swelling in the ankles, feet, or hands, signs of kidney problems, signs of liver disease, unusual tiredness, pale skin, signs of infection, and easy bruising or bleeding. If you notice any of these side effects, it's important to contact your doctor right away. In some cases, Pemetrexed may cause a serious skin reaction or a rash that could be a sign of a severe allergic reaction. If you develop a rash, especially if it's accompanied by other symptoms, it's important to seek medical help immediately. It's important to note that this is not a complete list of possible side effects, so if you experience any other effects while using Pemetrexed Disodium, be sure to contact your doctor or pharmacist for guidance. Before using Pemetrexed, it's important to talk to your doctor or pharmacist if you have any allergies or if you have a history of kidney or liver disease, or have had radiation treatment. It's important to be cautious while using Pemetrexed, as it can increase your risk of getting infections or worsen current infections. It's best to avoid contact with anyone who has a contagious infection, such as chickenpox, COVID-19, measles, or the flu. If you have been exposed to an infection, be sure to speak with your doctor for more guidance. Also, it's important to inform your healthcare professional if you are using Pemetrexed before receiving any immunizations or vaccinations. It's best to avoid contact with individuals who have recently received live vaccines, such as the flu vaccine inhaled through the nose. To lower the risk of injury, it's important to use caution with sharp objects and to avoid activities that could result in cuts or bruises. It's also important to inform your doctor or dentist about all medications you are using before undergoing any surgery. If you are a male, it's important to be aware that Pemetrexed can affect fertility. It's best to speak with your doctor for more information. If you are pregnant or planning to become pregnant, it's important to avoid becoming pregnant while using Pemetrexed, as it may harm an unborn baby. Your doctor should order a pregnancy test before you start this medication. Women using this medication should ask about reliable forms of birth control during treatment and for 6 months after the last dose, while men using this medication should ask about reliable forms of birth control during treatment and for 3 months after the last dose. If you or your partner becomes pregnant, be sure to speak with your doctor right away about the risks and benefits of this medication. It is not known if this drug passes into breast milk, so it's best to avoid breastfeeding while using this drug and for 1 week after the last dose. It's important to consult your doctor before breastfeeding. It's important to be aware that Pemetrexed Disodium 500 mg intravenous powder for solution folate antagonists may interact with other medications, which could affect how they work or increase the risk of serious side effects. This is not an exhaustive list of potential drug interactions, so it's crucial to keep a record of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. It's important to always consult with your doctor before starting, stopping, or changing the dosage of any medicines. If someone has taken too much Pemetrexed Disodium and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek medical help immediately. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can contact a provincial poison control center. It is important to have lab and medical tests, including complete blood count, liver and kidney function, while taking Pemetrexed Disodium 500 mg intravenous powder for solution. Make sure to keep all medical and lab appointments and consult your doctor for more details. Make sure to take each dose of Pemetrexed Disodium 500 mg intravenous powder for solution folate antagonists as directed by your doctor. If you happen to miss a dose, be sure to consult with your doctor or pharmacist to establish a new dosing schedule. This medication, Pemetrexed Disodium 500 mg intravenous powder for solution folate antagonists, is typically administered in a clinical setting and should not be kept at home. It is used to treat certain types of cancer, including lung cancer and mesothelioma. The dosage and timing of administration will be determined by a healthcare professional based on the individual's specific condition and needs. It is important to follow their instructions carefully for the best results. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.